Hello everyone, welcome to AY Tutorials. Today we are going to study the very important topic on the parenteral products. So without wasting our time, let's get started. The term parenteral has been derived from the Greek word para-enteron, which means outside the intestine. These are the unique dosage forms as they are administered by injecting directly into the body tissues through the skin and mucous membranes. The parenteral products are sterile preparations containing one or more active ingredients intended for administration by injection, infusion, or implantation into the body. They are packaged in either single dose or multi dose containers. These parenteral products are the sterile preparations and they are directly injected into the body. Types of parenteral products. The type of parenteral products are based on the volume and the state of product according to the USP. Some products are in the form of liquid, then some are in the form of powders. So there are the various type of the parenteral products. Based on the volume, they are classified into two types: small volume parenterals and large volume parenterals. That is nothing but the SVP and LVP. In SVP, an injection that is packed in the container, they are labeled as containing the 100 ml or less. And large volume parenterals, these are the parenterals which are designed to provide a fluid, calories and electrolytes to the body, and the volume is more than the 100 ml. Here are some advantages of the parenteral products. A parenteral products can bypass the first pass metabolism and the onset of action is quick. By passing the first pass metabolism, the onset of the action is obviously the quick. So in case of emergency, these parenteral products can be used. Then the drugs which cannot be administered orally, then they can be administered by the parenteral route. The patients who are vomiting or unconscious and cannot take the drug by the oral route, in that cases also we can use this route. The drug action can be prolonged by modifying the formulation. This route can deliver the transfusion fluids containing the nutritives like glucose and electrolytes such as sodium chloride. Here are some limitations of the parenteral routes of administration. Injection can causes the pain at the site of injection. It can be painful. The trained persons are required to administer the drug. The administration of the drug through the wrong route of injection may prove to be fatal. If the drug is supposed to be administered by a particular route, then if we are miss that route and if we give that injection to the another route, at that time the condition can be fatal. Then it is difficult to save the patient when overdose is given. There are the chances of sensitivity reaction or allergic reaction of the drug by an individual. These reactions can sometimes fatal can lead to the death also. Pre-formulation factors and the essential requirements. First one is the melting point. It is the temperature at which the solid and the liquid phases are in the equilibrium. Its determination is a primary indication of purity. Then second one is the solubility. This property is essential for developing the solution to be ingested either intravenously or intramuscularly. It is the function of chemical structure. Salts of acid or the bases are the drugs that can achieve the desired degree of water solubility. Molecular structure and the weight. These are the basic characteristics of the drug from which the potential properties and reactivities of the functional group can be determined. Then particle size and shape. The study of particle size, it gives the information about solubility, dissolution rate and absorption, etc. These characteristics are determined by scanning electron microscope or an optical microscope with polarizing attachments. Ionization constant. This property is used to determine the pH dependent solubility of the compound. The potentiometric pH titration or the pH solubility analysis is used for determining the pK value. The degree of ionization depends upon the pH. Then partition coefficient, it is a ratio of equilibrium concentration of the drug in the aqueous and oily phases in contact with each other at the constant temperature. Hygroscopicity, it is the tendency of solid to take up the water from the atmosphere. If a solid substance it take up the water from the atmosphere, then that capacity is known as the hygroscopicity. A high a high degree of hygroscopicity can adversely affect the physical and chemical properties of the specific drug substance. Vehicles used in the parenterals. Aqueous vehicle. Water is usually used as a vehicle for majority of the injections because the water is tolerated well by all the bodies and it's safest to administer. The aqueous vehicle used are water for injection free from carbon dioxide, and water for injection free from dissolved air. Water for injection is sterile water and which is free from the volatile, non-volatile impurities and free from the pyrogens because they are directly injected into the human body. These pyrogens, they are the byproduct of the bacterial metabolism. Pyrogens can be removed from the water by simple distillation process which sterilized by the autoclaving. Water for injection contaminated with the pyrogens may cause rise in the body temperature if injected. Hence, the test for pyrogen is done to ensure that the water for injection is free from pyrogens. Non-aqueous vehicles are also there. They are commonly used. Non-aqueous vehicles are oils and the alcohols. Fixed oil like arachis oil, cottonseed oil and almond oil, also sesame oil, they are used as a vehicle. The oily vehicles are generally used when the depot effect of the drug is required, or the medicaments are insoluble or slightly soluble in the water, or the drug is soluble in the oil. For example, dimercaprol injection by using the arachis oil as a vehicle. Ethyl alcohol is also used in the preparation of hydrocortisone injection. Hydrocortisone is insoluble in water and so the solution is made in 50% of alcohol. Alcohol causes pain and tissue damage at the site of injection, therefore, it is not used commonly. Here they have told us that there are the various non-aqueous solution and they are used only if that drug is not soluble in the water or the water for injection. Buffering agents. The degradation of the preparation which is due to the change in pH can be prevented by adding a suitable buffer to maintain the desired pH. Antibacterial agents. These substances are added to prevent the bacterial growth when during the storage. These substances are act as a preservatives. Here is the list of antibacterial agent. It is benzyl alcohol, methyl paraben, propyl paraben, benzalkonium chloride and thiomersal. Chelating agents. Chelating agents like EDTA and its salt, sodium or potassium salt of citric acid are added in the formulation to chelate the metallic ions present in the formulation. They form a complex which gets dissolved in the solvent. Suspending, emulsifying and wetting agents. These suspending agents, they are used to improve the viscosity and to suspend the particles for a long time. Methyl cellulose, carboxymethyl cellulose, gelatin and acacia, they are commonly used as the suspending agents. Emulsifying agents are used in sterile emulsions. For this purpose, lecithin is generally used. This lecithin, this line is very important. Emulsifying agent which is used in this sterile emulsion, for this purpose the lecithin is generally used. The wetting agents are used to reduce the interfacial tension and they are also act as anti-foaming agents. Tonicity factors. Parenteral preparation should be isotonic with the blood plasma or other body fluids. The isotonicity of the solution may be adjusted by adding the sodium chloride and dextrose, boric acid, etc. in the suitable quantities. These substances should be compatible with the other ingredient of the formulation. Examples of tonicity adjuster or modifiers are the glycerin, lactose, mannitol, dextrose, sodium chloride, sodium sulfate, and sorbitol. Tonicity is very important factor in case of the parenterals, as the parenterals are directly injected into the blood plasma, and there are the lot of tonicity adjusters which are added to the parenterals for the adjustment of tonicity. Here we have seen some information about the parenterals. There are again two parts. I will upload it very soon. Thank you for watching. If you like this video, please like, share and subscribe to the AY tutorials.